Let's know about the different type of the kits for the STIs today. There is totally 7 type of the kits that is present, and all 7 are very important and it's very easy to know. So first kit is gray kit and green kit. Gray and green are very common colors which we know, बिकॉज कैनुला में भी हम ग्रे और ग्रीन बहुत ज़्यादा यूज़ करते हैं. बिकॉज पहले तो मोस्ट कॉमनली यूज इज ग्रीन होगा, ज़्यादा फ्लूइड्स देना है तो ग्रे देंगे. सो ऐसे ही इधर भी मोस्ट कॉमनली यूज इज ग्रीन एंड बिकॉज वेजाइनल इन्फेक्शन होगा, सर्वाइकल इन्फेक्शन होगा तो थोड़ा कॉमन ही हो जाता है इन रिप्रोडक्टिव एज ग्रुप. सो नाउ लेट्स टॉक अबाउट द ग्रे किट. ग्रे किट कहाँ यूज़ करते हैं? एज आई टोल्ड, यूरेथ्रल और सर्वाइकल डिस्चार्ज होगा तब हम यूज़ करते हैं ग्रे किट. सो दिस टू इज़ यूजुअली कॉज्ड बाय द गोनोकोकल इन्फेक्शन एंड द क्लेमाइडिया. मोस्ट कॉमन ऑर्गेनिज्म कॉजिंग इज गोनोकोकल क्लेमाइडिया. को इन्फेक्शंस प्रेजेंट होता है इन दोनों का. सो इन दोनों को अलग अलग ट्रीट करना है. सो अलग अलग ड्रग यूज़ होता है. सो ड्रग ऑफ चॉइस फॉर दिस इज सेफिजाइम. ड्रग ऑफ फॉर क्लेमाइडिया होगा एजिथ्राल. सो अब देख लो ग्रे किट में क्या है. एजिथ्राल होगा, इतना क्लियर नहीं है बट स्टिल आई राइट इट हियर. एजिथ्राल 1 ग्राम. ओडी देता है स्टैट. सेफिजाइम 400 mg ओडी देता है स्टैट. ठीक है डन. अब ग्रीन किट देखते हैं. ग्रीन किट में यूजुअली दैट इज यूज फॉर द वेजाइनल डिस्चार्ज होगा. यूजुअली लेट मी राइट इट डाउन. वेजाइनल डिस्चार्ज के लिए वी यूज द ग्रीन किट. वेजाइनल डिस्चार्ज, देयर आर 3 टाइप्स ऑफ द वेजाइनल डिस्चार्ज वी हैव टू नो. एंड उससे पहले वी हैव टू नो दैट देयर इज फिजियोलॉजिकल डिस्चार्ज होगा. इफ देयर इज अराउंड द मिड साइकिल, in the mid cycle like around the 14th day of the cycle white discharge होता है. वो white discharge not non foul smelling होता है, प्लस इतना स्टिकी भी नहीं होता है, एंड दैट इज फिजियोलॉजिकल डिस्चार्ज. Now we have to come about the bacterial discharge. Bacterial discharge मतलब there is bacterial vaginosis होगा. There is bacterial vaginosis. There is trichomonas, and then there is the candidial vaginitis. So now we have to know about these things. So अभी bacterial vaginosis के बारे में we have to know one most important thing is it is caused by the Gardnerella vaginosis, and इसमें when we do the smear करते हैं क्लू सेल्स दिखते हैं. हम सबको पता है क्लू सेल्स क्या है. ये है एपिथेलियल सेल होगा, उसको सराउंडेड बाय द बैक्टीरिया होगा, वो है क्लू सेल्स. द मोस्ट इम्पॉर्टेंट फीचर फॉर दिस इज द क्लू सेल्स. ठीक है. एंड देन इसमें तो विप टेस्ट करते हैं विच 10% KOH के साथ वो पॉजिटिव होता है, एंड इट गिव्स फिशी ओडर. इसको ट्रीट करते हैं हम मेट्रोनाइडोजोल से. ठीक है. नेक्स्ट वी हैव टू नो अबाउट द ट्रोकोमोनास वेजाइनालिस. सो इट इज कॉज्ड बाय ट्रोकोमोनास वेजाइनाइटिस कॉज्ड बाय द ट्रोकोमोनास वेजाइनालिस. ये है मोटाइल. ठीक है, ये है मोटाइल. सो कैसे दिखता है? इट हैज़ 1 axon and it has flagella. It has 5 flagella, 1 lateral flagella तो present है इसका. axon तो present है. So एक ही sucker present है इसका. ठीक है, इसका डिस्चार्ज कैसे होता है? सो ये है ग्रीन डिस्चार्ज होता है इसका, ग्रीन कलर डिस्चार्ज, ठीक है. एंड नाउ वी हैव टू नो, सॉरी आई डिडंट टेल इन द गार्डिनल वेजाइनालिस, इसमें होता है ऑफ वाइट डिस्चार्ज. नेक्स्ट we have to know about candidal vaginitis. So Trichonoma vaginalis. Trichonoma vaginitis is being caused by the Trichonoma vaginalis. Okay. So this organism is the motile organism. It has a twitching motility. Okay. And few microbiology stuff is that it doesn't have cyst and it has only tropozoid, and the infective form is the tropozoid. So whatever I have drawn here, it is a tropozoid. It is badminton, we all play that badminton tennis racket. So that is badminton racket appearance is seen, and it has one axon, and we have the one, this is the axon. Okay, so this is the axon, this is the sucker. Okay, so it has only one sucker and it has the 5 flagella. In that, one is the lateral flagella which is seen, so which is giving the twitching motility for it. So drug of choice for this is metronidazole, and in this both the partners has to be treated. Okay, both partners has to be treated. Next, okay, both partner has to be treated. Now let's see what is the kit includes. So it includes fluconazole. We know why it is fluconazole, because it is for Candida albicans, drug of the choice is fluconazole. So 150 mg single dose has to be given. And skikendazole, instead of the metronidazole we use this drug. So it is skikendazole 1 gram BD, okay, BD dose with fluconazole 150 mg OD has to be given. This is kit 2. Okay, next, now the most important kit, which is little confusing but it's still good. So we have, first remember the vesicle or erosions. First let's go for red kit. So vesicle or erosions are usually red in color, so that is red kit. So vesicle and erosions, if they are present below the belt level, so where we wear the belt, when we wear a pant and where we wear the belt, so that belt se niche hoga. So if it is below that belt region, then it is caused by the HSV2. Okay, if it is present above the belt region, it is called by the HSV1. So what is the drug of choice for this? The drug of choice for the red one is, we have to, it is not so clear, so let me write it. It is tab acyclovir 400 mg TDS for 7 days. Okay, this is the red kit. Red kit is the kit 5. Okay, that is kit 5. So that is kit 5, we have to remember. Now then we have kit 5. Now let's do kit 3, kit 4. So there are 3 painless ulcer that is present. First painless ulcer is the H. ducreyi. First one is H. ducreyi, which causes the chancroid. Okay, it causes chancroid. And second one is the, when we can see the hard indurated base plus the painful indurated base है plus the painful rubbery जैसे दिखता है. So वो syphilis है, वो usually primary syphilis है. So कहाँ पे दिखता? So then there is secondary syphilis. Secondary syphilis मतलब secondary syphilis में we can see the soles and the palms are soles and the palms are being usually involved in that is skin is involved in the secondary syphilis. We have to remember this. Okay, next painless is the hard beefy like appearance. So the third one is the hard beefy like painless ulcer which is present, that is caused by the donovenosis, that is called as the donovenosis caused by the granuloma inguinale. So all these three painless ulcers or the painless wound, this is we usually use the kit white, that is the kit 3. So it is not clear, let me tell you what does it include. Kit white includes the, so this is the kit where we use the injection. Okay, so it includes the injection when it includes the benzathine penicillin, 2.4 million units, 1 dose. Okay, next there we have to give tab azithromycin 1 gram OD stat. Okay, so now in the patient who has, now if the patient has resistance to this, if patient has the resistance to this, if the patient has any resistance or allergy to the benzyl penicillin, then instead of this we use the kit 4. We use the kit 4, that is instead of benzyl penicillin we use doxycycline 100 mg BD for 15 days, and then azithromycin 1 gram OD stat. It's just that in the place of the penicillin we have to replace the doxycycline. Okay, that is it. Now, so we have done with the kit 3, kit 4, kit 5. Now what kit is left? Kit 6 and kit 7 is left. This is very simple. Kit 6. So this kit 6 is yellow kit. Yellow will sound like low. So yellow, low. So last 3 letters, we have to choose the last 3 letters of this. We have to choose the last 3 letters of this, that is low. Okay, that is low. So what is low? Low say yellow. Lower abdominal pain. Okay, it includes the lower abdominal pain as seen in the PID. So what is the drug of choice in this? We use the cefizem 400 mg single dose, metronidazole 400 mg BD for 14 days, doxycycline 100 mg BD for the 14 days. These 3 drugs are used. What are the drugs? Let me repeat. Cefizem 400 mg single dose, metronidazole 400 mg BD for 14 days, doxycycline 100 mg BD for 14 days. Now the next important, black. We know black is bad. So B say bad, B say black. Okay. So, and we have to remember B say buboes. What is buboes? So it is an enlarged. So let me show you. I have an image. Yes. So I think all of you can see this. So this is buboes. This is an enlarged inguinal lymph node is there. It looks like this. It looks very swollen, it looks red. So this is called as a buboes. This is usually painless. This is usually painless and caused by the lymphogranuloma L1, L2 and L3. Okay, so what does it include? What does it include? It includes doxycycline. It includes doxycycline 100 mg BD for 21 days, azithral 1 gram for single dose. So what is includes? Doxycycline 100 mg BD for 21 days, azithral 1 gram stat. We know this since a very long time. This, so we can remember just like this. Blue and black has same drug and doxyazithral. This is for 100 mg for 21 days. The difference is this is for the 15 days. This is for the 21 days. That is the difference. Okay. So here we come to an end for this kids. I hope that you guys understood it. Thank you.